Welcome back to Questions You Didn't Ask with me, Niasha Fray, and my guests, Jennifer Thornton Jones and Dr. Gail Wyatt. As we continue the series, Ageless Intimacy, Real Talk for Women 40 Plus, let's dive back into the discussion. This conversation is so rich, and I'm sure my audience is enjoying it just as much as we are. One of the things that I want to bring into the discussion is kind of the pinnacle issue that got me fired up for this show, right? And that is, Dr. Wyatt, when I started my research career in HIV research, I was encouraged, almost commanded by my boss, who was the principal investigator for the research study at UNC School of Nursing. And her name is Dr. Kathy Fogel, to attend a conference at my alma mater at Teachers College and specifically seek out your session. She said, if I approve you to go to this conference, you have to go see Dr. Gail Wyatt. So, and that's how I came to meet you. And I'm so thankful for her for making that requirement of me. And so as my career has continued in the space of HIV/AIDS research, specifically around social behavioral research, one of the things that we used to talk about a lot was domestic, as in America, African-American women were in their 30s and 40s contracting HIV, heterosexual women.
Mm-hmm.
And everybody was like, okay, so the way we're going to intervene through a social behavioral aspect is to educate them about their self-worth,
Mm-hmm.
to empower them to communicate, to be safe in their sexuality, make sure that they're using condoms, even providing lube and different things like that. And they were like, you know what, if they do all these things, then they won't be contracting HIV at this rate, right?
Mm-hmm.
And so I was all on board, all on board. Then I grew up, right? So life course. And then I realized, and I'll go back just a step and say that I had an experience where I was privileged to go to Malawi, long way Malawi, and work with a health clinic there and some talented nurses and community outreach and healthcare workers. And one of the things that had us as an American research team take a step back in how we were training them to deliver this intervention was the fact that they let us know that in their culture, dry sex was the norm.
Yep.
Boom, right? So my brain exploded, right? Because in America, in Western society, lubricated sex is the norm. As we talked about, if she is wet, if her vaginal juices are flowing, the man or woman, whoever her partner is super excited. This is going to be great, right?
Mm-hmm.
So then, as I got older, I found out, and my own body went through all types of changes for multiple reasons, that when you have gone through a certain phase of your life, your body's ability to self-lubricate decreases.
Yes.
If you've had certain treatments, your body's ability to self-lubricate decreases.
Mm-hmm.
But especially a certain phase in your life, right? Bingo, 40 plus, generally speaking. And you guys are the experts, so you can clarify that age range for me. And so I said, well, no one told these women when we were educating them that their bodies are naturally changing and that they have to have a different conversation.
Mm-hmm.
Safety looks different because even with a condom, you might experience pain. You might experience irritation. You may have trouble coming to climax, depending on how your body is changing. So even if she has high self-esteem,
right?
To do with none of that changes the fact that her body is different, but no one bothered to tell her that was going to happen and that she could make adjustments. And what I know about you, Dr. Wyatt, and you too, Jen, is that you all have some extraordinary expertise to help women navigate that. Can you talk a little bit more about what happens to women's bodies and how that can set them up to have either risky sex where they might contract something
Mm-hmm.
because of physical dynamics,
Yes.
right?
So, Jen,
Not because she doesn't love herself.
right. If you want to start childhood to preteen,
Hey, do what you do.
okay. I'll say a little, then I'll flip it to you. Okay.
Oh yeah.
If you're dealing with a child, if you're dealing with someone who hasn't had a menstrual period yet, which is a regular cycle of bleeding for several days, and that's a way of sloughing off tissue that your body doesn't need right then, and that you should protect that liquid from getting on your clothes or staining it, and little girls need to know this may happen when they're in school and they're not with their families, and they have to be prepared with a little package in their purse or their lockers so that if they see a little dripping of something, that they can use something in their underwear to protect the underwear and themselves from getting all over the place. That education doesn't talk about lubrication or anything else, but it just talks about preparing a young girl, preteen, to the changes that we know are getting ready to take place. That is something that most mothers, I find, that Jen, correct me if you see something different, don't mind girls knowing that your period's going to start anywhere from 9 to 12, 13, 14, 15. It's going to start. So you might as well be ready. Don't be embarrassed and humiliated, because sometimes nurses and health professionals at the school or the principal or the teacher are very cruel, and they say things to your child that are indelible, and they can't forget them. So we want to protect girls and to start this phase of their life in a positive way. Okay, Jen, what do you say?
I think absolutely. And I think that speaks to, again, like, it's not like you can have trauma that happens to you that's related to this area that is not necessarily a physical or a sexual trauma. So I think one area when it comes to girls that really pops up is the conversation that we have around menstruation and how that is coded for a lot of women in terms of a secret, a dirty aspect, or a just something, we would not talk about this in front of other men. We wouldn't talk about this, this is something you take care of. It's very private. And for some patients that I have, even though their mothers or caregivers are willing to talk to them about how to take care of it from like a hygiene standpoint, they don't necessarily talk to them about how to take care of this from a like personal care standpoint. I also think that one thing that we don't talk to girls about, which boys I think are getting this education, I don't think they're getting it in a very good way, but women are not necessarily spoken to about the pleasure centers of their genitalia in the same way that they are educated on the reproductive function or the menstrual cycle. Whereas boys, because it's right there, tend to get this education. Whether it be through a great source is another question. But if you wanted, I know we mentioned sort of like using people's bodies to sell and how sex is a business. Well, pornography is a huge business. And so for a lot of people, they're getting that first education a lot younger. First of all, I think the most recent data is that I think is it 8 or 9-year-old boys have been exposed to pornography.
That's how they learn sex education.
And that's where they're getting their sex education. So this is through the male gaze. They're looking at two, I would say in general, most likely altered bodies. Unrealistic. Yeah. I'm trying to be as inclusive as possible, but I'm pretty sure these two bodies are not going to be a natural or completely 100% natural body. And they're also looking at this through the male gaze, which is going to be focusing on the male penis, an altered vulva, and how that interaction looks, and who gets to take the power, and who gets to start that sexual arousal cycle. And again, it's the male gaze. It's going to be focused on the penis. It's going to be focused on that advance.
And a willing partner, Jen. A willing partner who's smiling, saying, oh, okay, we're in the middle of a mall, but hey,
Right. And would you say maybe an overly willing partner? Like, I personally have never had the response where someone's come up to me and I've just been like, what? Like,
Yeah.
so that education, first of all, for men isn't coming from a great place. Women aren't getting it at all. So
Right.
then at what stage are women getting any education around their clitoral tissues, around their vulva, around any of the other aspects of sexual health that aren't reproductive related? They're
Yeah.
probably getting it from their first sexual partner.
Mhm.
If their parents are not willing to talk to them about it, right?
Mhm.
And so their first sexual partner probably hasn't gotten the best education. So I actually feel for young men in this situation as well. Like, they don't know what they're working with. They haven't been given good education about their own bodies or about what their partner is doing or about any of what this is supposed to look like.
Mhm.
And so then you have this girl who is experiencing this from, well, this is what I'm supposed to be doing, or this is what this should look like. This is what my role is. And getting all of that at a young age from really poor sources of education.
Right. So we enter this whole discussion and this whole development, this whole period of our life along this life change trajectory, poorly educated, information distorted, no idea of who we are and what is where. Okay. Then we enter the beginning of the reproductive phase in that shape. And people wonder why we've had in the past such high incidences of teen pregnancy. And it's amazing to me that people could get through adolescence with as little help as they get in this society where we should know not pregnant, because there's almost nothing that's provided on a consistent basis from household to household that everybody's got to know. Now, if you go to Scandinavia, Sweden, Denmark, Norway, their sex education, just to look at another society and part of the world, everybody gets sex education early in life. They also have health records, particularly in Denmark, from birth on. So you can study a person and their health and their brain from the beginning of their lives. Imagine what that could do for a health professional trying to help you. If you come in with a complaint, if you have records that follow you, that allow the health provider to really know what have other people told you, what kind of experiences have you had, even if you don't tell them yourself, it is written somewhere to kind of help a person, to give you the right advice so that you do get the help you need. So our society has choices. We have chosen a very conservative, prudish style of educating people that has led us to now this business of we have a lack of births. We have a birth crisis. People don't want to have children. And it's sad. They don't understand what sources and what options they have. But the way that we're educating people and then allowing them to have traumatic experiences around birth, childhood, having too many children that they can't afford and that have health problems or whatever, no health care that goes along with that, just on you, and wonder why people don't want to have children. This is what's so amazing to me, that people actually are promoting as if the Bible, I'll back up and take the Bible away and just say certain religious information is the only source of information that one person needs to have. Well, that's a choice again, but you have to get enough information from multiple choices in order for you to live your life. That's my feeling. And I encourage people to go out and read and bring it into therapy. Show me where you found that statement, because I'd like to learn it myself. And I've had to read in all kinds of religions in order to help people to understand where it is they're starting. Where did this thought come from that's influencing your attitude about the fact that women are born to have sexual pleasure? We're the only of the genders that are born to have sexual pleasure. We have a clitoris. The penis has to serve many purposes, but the clitoris only has one.
Mm.
That is to make us feel good. And we are discouraged from looking,
Mm-hmm.
touching,
Mm-hmm.
communicating that to our partners.
Mm-hmm.
This is crazy.
Mm-hmm.
This is just to take away the power, the potential power that a
Mm-hmm.
woman would have if she knew when she was growing up that she had when she was ready and when she understood her options, that she could experience sexual pleasure like nothing else in her life, and that she deserved it because that was part of her body.
Mm-hmm.
It's not an appendix that you can just, it's there, but nobody knows what to do with it anymore. No, clitoris actually has a purpose.
Mm-hmm.
We just aren't educated to know it,
Mm-hmm.
enjoy it, and use it.
Mm-hmm.
And the
Amen.
clitoris as an organ was only fully mapped out anatomically in terms of how deep and how large it is in 2005.
Isn't that something? Yeah, this is
So
new
it's not
knowledge.
like we have this information that's not getting disseminated. We
New
also
knowledge.
have an
Yes.
issue higher up
Mhm.
in terms of
No,
who's looking at
but
this
that's,
information.
I'm trying to show you that that's not the first time people have known there was other information to share, and they just didn't share it.
Hmm.
So there has been an agenda on the power of women from time immemorial, as far as I can see. And it's
Woo.
of concern because here we are with it right in our faces. And there's some people who still don't get it. They actually think we have a choice in an election.
Mm.
Well, you can choose not to care about reproductive health. That would be like saying, just cut me on up. Take out the pieces that, I may not use today because they're not important.
Mm.
I think to speak a little about that time period that you're talking about, Gail, as well, in terms of that like transition from childhood into early adulthood, maybe if that moves on to matrescence. I think apart from sexual arousal, another sensation that women are taught to really ignore is pain during this time. I have so many patients that are coming to me because they're having sexual pain, and they very much report the first time I ever tried to use a tampon, it was painful, or I've never been able to insert a tampon because it was painful. And then we might move on to, okay, my periods are getting really bad. I'm having really painful periods. But just, again, whether that comes from the culture telling them that that's normal, whether that comes from a provider who is not listening to their symptoms, whether that wherever that's coming from, it's then, okay, well, I'm just going to kind of ignore the fact that this is debilitating pain.
Right. And a mother might hear it from her daughter every month that she is experiencing painful periods and really doesn't need to go to school or can't go to school or can't study. And she feels that she's malingering, that she's just using that as an excuse not to go to school. When now we know the endometriosis and symptoms of endometriosis can start very early in a woman's life. And if we ignore it, then later on we can end up with a huge issue that we perhaps could have prevented if the health professionals, if our parents knew that this may not just be malingering, it may be something that's beginning in her body, and that we need to look at her periods and look at her hormones and try to understand what do periods do to her that make her so uncomfortable, and help her, educate her about exercise and diet early so that she's doing everything she can to allow that period to be included in her life and her functioning, and it doesn't debilitate her once a month.
And I think definitely it's important for all women, but it is extremely important for Black women because we know that these pelvic pain syndromes, endometriosis, fibroids, these things are more common and more often treated later for women who are Black.
Yes, absolutely. But in medical schools where there are many, many Black doctors, like Meharry Medical School, I really feel Howard, Morehouse, the medical schools that serve in predominantly people of color communities, there should be research funded so that we're looking at these things that occur more often in populations perhaps that they serve. Information like that should be available everywhere. But
Mm-hmm.
now we're identifying what's missing in our world, right?
Mm-hmm.
And this is an opportunity for
Mm-hmm.
political administrations to key up on things that we need to do, not just asking people to vote and whatever. We're talking about if you want to lessen a disparity, then let's get more research on the population that can help to alleviate the disparity beyond
Mm-hmm.
just implicit bias, just somebody
Mm.
making assumptions. You're not really in pain because when
Mm.
hundreds of years ago, not that many hundreds, but years ago, when your ancestors were enslaved, nobody paid attention to your pain, so they made it. So you should be able to make it now. That's essentially where that thought comes from.
Mm-hmm.
21st century. We saw your ancestors never complain. That's because if you did, you'd get sold away from whatever family you had to today. The connection is made amongst whites about blacks, but there's very little that's believed by black professionals that maybe the education that we're receiving has so many biases in it.
Mm-hmm.
You actually piece those two together. If your
Mm-hmm.
ancestors didn't complain, why are you complaining?
Mm-hmm. You should be grateful.
You should be grateful and quiet.
I think in medicine, there is such an interesting conflict between, when it comes to women's health a lot of the time, between this is natural and therefore does not need to be intervened upon, and this is something that we can make better, and that it's okay to look into treatments to make something better. And I feel like that really uniquely happens with women's health quite a lot. It uniquely happens in like the birth sphere a lot. And also I think around menopause and around these changes of puberty and menopause, of like, these are natural symptoms, you just deal with it. Versus these are like, when to understand when something is not within a normal sphere, or even if it is normal, is there still something that can make this a little bit better and easier for you? And I feel like that is pretty unique in women's health, that sort of weird juxtaposition of natural versus something we should intervene upon.
I agree. I don't think that women are supposed to really enjoy sex. All of the focus was on erectile dysfunction. Every pill has been evaluated to death and even used with women in an effort to use something that was tried on men, tried on women, as if it had a basis for using with women. That women's bodies are essentially the same, except that we don't have a penis. So the thinking, I think, has crippled our ability to appreciate women's sexuality. And what we need is a more progressive attitude of health professionals speaking to our Congress and our presidents about what we need if we want to alleviate disparities in health. It's beyond skin color. It's really beyond understanding what gender means. Does it mean anything at all? And we're still grappling with that. And then what kind of research do we need, and what kind of training do we need to provide to a student who wants to become a health professional or a clinician?
Thank you for joining us on Questions You Didn't Ask with me, Niasha Fray, and my guests, Jennifer Thornton Jones and Dr. Gail Wyatt. Tune in next week as we continue our series, Ageless Intimacy, Real Talk for Women 40+.